So Sadie Engelken, I'm a clinical exercise physiologist and certified cancer exercise specialist. I worked with my first cancer patient in 2017. I was an intern at the University of Northern Colorado Cancer Rehab Institute and essentially fell in love with working with the cancer population, which is the reason I pursued my master's degree in clinical exercise physiology at Carroll University in Waukesha, Wisconsin. I actually followed my clinical and research coordinators from UNC up there to further really study chronic disease and cancer, and specifically the phase program that was published as part of ACSM in terms of training cancer patients. So I got another 2 years of really heavily working with cancer, but also chronic disease, studying that deeper in terms of education and what we see in the traditional aspect, and then getting some more experience. COVID then happened, and things shut down. I had the opportunity between undergrad when I did that first experience and my master's degree, and in those few years, kind of as COVID started, I worked at 3 different medically integrated gyms. And every time I got a job, I said, any person who goes to this gym that has cancer that wants to train with someone, I want to train them. I really want to continue working with this population because I'm passionate about it. Some of those gyms even had programs specifically where I could do a group exercise class for cancer patients, and I worked on building some of those things. One of them even had a cancer patient himself who was then a coach and was an oncologist, and he taught bike classes for his cancer patients. And so they, could come and meet with me also, which was a great opportunity. I moved to Kansas City to actually teach, to show more students how, this clinical aspect of EPs and CEPs was a great opportunity within the exercise science field, because I didn't feel like it was largely talked about as I initially went through school. I kind of pursued it. And then my professors supported me in doing that kind of exploration. But a lot of challenges in academia, and the biggest thing I missed was my patients. An amazing opportunity essentially was dropped in my lap, where a woman in Kansas City was looking for someone to support her business that was contracted through multiple hospitals there. And I worked as a wellness coordinator, which to describe to nurses or other people, it looks like a rehab or an exercise navigator, like a nurse navigator within the cancer realm. I was able to assess patients, talk to them about the struggles that they were experiencing because of their disease or their treatments. I then could give them, exercise prescriptions to take home. I could connect them with community resources if they needed, physical therapy or therapy, making sure we got those orders. The biggest thing that I missed at that job, though, was we didn't have a gym space, or a space for me actually to provide the intervention within the hospital. And I knew I wanted to pursue that. So in 2023, I made the move to Chattanooga, Tennessee. I'm employed by the cardiac and pulmonary rehab department and share my time working with the cardiac patients, pulmonary patients, as well as from the ground up of paperwork and consent forms and documentation and policies, starting last June to then having my very first patient in December, and now continuing to grow the program and add an inpatient component to it. We're just going to continue to grow. And the goal would then be that, my job will evolve and I will then get, the title within my organization will be, cancer exercise specialist or clinical exercise physiologist specializing in cancer. Or, I would love one day to get cancer rehabilitation added to our gym space when people walk in. So, I can tell them you're coming to the rehab gym, not you're coming to cardiac and pulmonary rehab for your cancer exercise program. So that's kind of my story and how I really took one internship experience that changed my life, and just kept through all the challenges, changes, moving different jobs. I knew I wanted to continue to grow in this field. That I feel like right now I have like three buckets of patients that I see. So I'm happy to pick one and talk about the experience and what that looks like. One really big population is I am getting a lot of GI surgeries, or specifically Whipples. And we're doing prehab, which for some people looks like 3 exercise sessions, and for some people looks like 12 weeks of exercise sessions, followed by surgery, and then follow up with as quickly as even like 5 weeks now. I've seen a patient post-surgically to just really ease back in, with a lot of, specific things that you have to consider in that, but really slowly ease back in. So that's kind of one bucket. One bucket is just on treatment patients,
Mm.
people that you're trying to navigate, like, what does your on treatment week look like? Can you come in, the day before you get chemo? And then if you don't feel great, what are we doing at home? If you can come in, what is the day that you can come in still on a chemo week look like? How do we modify that prescription? And then
Mm.
what do our in between weeks look like when we feel really good? How do we, essentially maximize our opportunities when we have less fatigue or less nausea, or you're not getting dizzy because you have low blood pressure from your treatments or the side effects. And so that's kind of the second bucket. And then the third bucket has actually been, I have 4 or 5 prostate cancer patients right now that are on ADT, and also on radiation. And so it's getting them through, like, you're starting this deprivation therapy and you're doing radiation all at once. So your body's going through all kinds of changes. You have lots of fatigue. Things aren't quite working the same. We're trying to, like, not gain fat and maintain your weight, and also get muscle. And for a lot of these men, they're trying to lose some weight because they're heavier set. And so you're not trying to lose too much weight because you're on treatment. And so that's been a really fun group to work with and see, because so many of the nurse navigator's biggest worry was they're going to have so much fatigue, and to really not see them get hit with as much fatigue and also not gain any weight and still maintain or have positive improvements in their strength measurements, at 12 weeks has been fabulous. And for some of these individuals, we're tailoring their prescription that they're able to do something every day after radiation if they wanted to.